Welcome students. Today we'll be discussing a very important topic, that is ATCOM. ATCOM means attitude, ethics and communication. So this part has been included in First MBBS curriculum from this year, that is 2019-20 batch. So students, in ATCOM there are 5 modules for First MBBS: ATCOM 1.1, 1.2, 1.3, 1.4 and 1.5. So ATCOM 1.1, that is related to what does it mean to be a doctor. ATCOM 1.2 is what does it mean to be a patient. ATCOM 1.3 is doctor patient relationship. 1.4 is the foundation of communications. ATCOM 1.5, it deals with cadaver as our first teacher. So students, in brief, I will introduce today regarding ATCOM 1.1. So ATCOM 1.1, in this module we will be covering what does it mean to be a doctor. So in this topic, in this module, the expected competencies are: the student must be able to enumerate and describe professional qualities and roles of a physician, describe and discuss commitment to lifelong learning as an important part of physician growth, describe and discuss the role of physician in healthcare system, and last one is to identify and discuss physician's role and responsibility to society and community that he or she works. So what is the basic background regarding this ATCOM 1.1? So the main aim of introducing this topic is to make students aware about our profession, medical profession, that they had chosen for their career. What are their duties and what are their responsibilities towards the profession and community? And what are the challenges they will have when they are exposed during learning and clinical practice? And what are the career prospects? So all these basic background they should know. The students are to be trained and their thinking modulated to achieve excellence in their career. And as they proceed in their journey of medical studies, they should be optimistic and charged up with enthusiasm. So medical profession is a noble profession, you are knowing that. Many of the students nurture the desire to become doctor from time when they are very small. So general medical practitioners, they are MBBS. So medical students who pursue MBBS degree, Bachelor of Medicine and Bachelor of Surgery, after completion, so after completion of internship, usually enter clinical practice and they are referred as medical practitioners, general medical practitioners. So their duties are centered towards promoting, managing and restoring physical and mental health. They are referred as physicians, general physicians, while those who are trained in postgraduate course medicine, MD medicine, they are referred as specialists. Those who become specialists in pediatrics, they are called pediatricians, ophthalmologists, surgery surgeons, obstetricians, gynecologists, radiologists, biochemists, microbiologists, pathologists, like that. So various branches of specialties, they are available after the student completes graduation, that is MBBS. So students, we are very eager to know regarding professional qualities of a physician. So the first most important professional quality of a physician is moral intellect practices with responsibility and accountability. So the doctor with moral intellectual practice of medicine as per ethics or as per ethical guidelines which are laid down by National Medical Commission, previously Medical Council of India, with utmost sincerity, devotion, dedication, commitment, selflessness. So all these qualities the general physician he should have. Again, he should have responsibility, sense of responsibility, readiness for accountability for any mishaps, positive, negative. So he should apply medical knowledge and skills in treating patients. So second important quality of medical physician is ethical and legal codes of conduct. So he should be responsible for principle of informed consent, confidentiality. Then he should have adequate knowledge of medical, legal, ethical, humanitarian principles which are influencing healthcare. So he should be aware and able to manage ethical and professional conflicts. Third one is personal attributes. He should be kind, compassionate, accommodative, humanistic, honest. He should be a good listener towards his patient. Then most important is he should have knowledge and skills. So a best doctor or a good doctor will use his knowledge, wisdom, and will give best possible services which will be helpful in saving patients' disease. So practices pertaining to specialty, that is next important quality. So the doctor who is specialized in particular branch will do his specialty practice which he has achieved during his post-graduation. Then professional conduct. So a good doctor maintains very good conduct towards his patient, colleagues, professional colleagues, community. Which according to the guidelines which are recommended by Code of Ethics by MCI. Then good doctor is very humble and he believes in services rather than publicity. So he should avoid publicity. Then he should not make unnecessary referrals. Nowadays it is happening, unnecessary referrals are done, huge number of investigations are advised to the patients unnecessarily. He should genuinely suggest if investigations are required, if surgery is required. So he should give good advice. Unnecessary referrals should be avoided, and if referral is must, he should refer. He should not play with the patient. Then most important is he should have adequate knowledge of anatomy, physiology, pathology. So he will be able to diagnose various diseases on the basis of biochemical tests, biochemical basis of disease, pathological basis of disease. So he should have participation in national and regional healthcare program. So he should have adequate knowledge of national, regional healthcare policies. You are knowing various diseases, they are very important. Nowadays COVID pandemic, that is managed very well according to national guidelines, central guidelines. So we are managing all these things. So he should have adequate knowledge of health care policies for various important diseases such as COVID-19, then tuberculosis, diabetes, hypertension, leprosy. So these very common diseases, communicable diseases, and some non-communicable diseases. All national health programs the doctor should know. Then most important is he should have excellent communication skills. A good doctor is excellent communicator. He elicits history of disease from patient and from relatives. So history taking is very important. So if you are having good communication skills, you can get complete history, and that will helpful in easy diagnosis of disease and patient management. Then he should maintain, very important is nowadays Consumer Protection Act is there, so he should maintain accurate record of treatment given to the patient, whatever he has given treatment, which operation he has done, so everything, if he is admitted, so all the records he should keep, and that is very helpful when there is follow-up. Patient comes for follow-up for management purpose, that is very important. Suppose somebody goes in court of law, then if some negligence occurs, then you should have your record that you have done correct treatment. So it is required in case of medical litigation and administrative frameworks. Then most important is altruism. So what is altruism? So a good doctor shall ensure patient's interest over self. So any error by omission or commission as part of altruism must be disclosed to patient and medical hospital authorities as a noble practice methodology, which otherwise is not usually done. So good doctor is one who is successful in disease prevention, health promotion, then he prevents pain, prevents distress, rehabilitation of patient is done. So in brief, we will summarize qualities of good doctor. So a good doctor is caring, loving, compassionate, kind. He is assuring patient. Then he is listener, good listener. Then he energizes patients with peace and confidence. He is having humanistic approach. He is honest. He practices confidentiality. Then he gives a sense of hope, for recovery. He gives confidence. He uses his clinical skills, knowledge in saving patients' health and giving him new life. He is always taking knowledge. He is optimistic. He is selfless, and he serves sick selflessly. So these are, in brief, qualities of a good doctor. So in next lecture we will see regarding how doctor is a lifelong learner. Thank you.